local health departments to promote laws and to oversee that the iodine intake by the general population is sufficient. Together, we can promote this important project. How? Through ministries of health and government organizations, medical professionals, for example, endocrinologists, as I said, gynecologists, obstetricians, pediatricians, of course, general practitioners, healthcare workers, nurses and midwives who are very important in this project, scientific medical societies, industry such as salt and sugar feed, journalists, patient organizations, social never underestimate the power of the next generation. Family. I have found that so many times when we educate our children, they in turn educate us, their parents, and their family. Thank you and salamat for your kind attention.
Thank you very much, Ma'am Linda Henderson. We concur that collaboration of different sectors is necessary to promote Mother Baby Iodine Awareness Project. Now, we are very fortunate to have with us an accomplished speaker from the World Health Organization. He is currently the team coordinator of WHO Philippines and is responsible for coordinating strategic technical assistance against communicable and non-communicable diseases. He's also part of WHO. He was also part of WHO in Cambodia, Papua New Guinea, and in India. To discuss thyroid as an important non-communicable disease impacting global health, let us all welcome Dr. Rajendra Yadav. Dr. Rajendra, the virtual floor is yours. You may now share your screen.
Thank you, ma'am. I'll just share, just hold on. Can you confirm that you can see this WHO logo?
Sir?
Can you see this WHO logo?
Yes, sir, but we need to hear you. Can you make it louder, please?
Yes, I'll try to shout.
Oh, I'm so sorry for that. Thank you,
No
Doc.
problem. So thank you for this opportunity. I have a few slides to show over the next 20 minutes. Just hold on. Okay, so I'll be talking about thyroid and non-communicable diseases. My focus of this presentation will be on thyroid cancer, iodine deficiency, and iodine-induced dysfunctions. For any disease, if you want to measure the burden of the disease, generally we use disability adjusted life years lost. This is a measure of overall disease burden expressed as the number of years lost due to ill health, disability, or early death. And we may express that as days lost per 100,000 population. It could be in all age groups or some age groups. It could be in both sexes or one of them. So the data I'll show is in all age groups and on both sexes and 2019 data. So as this slide shows here, if we look at the non-communicable diseases, they are contributing to 64% of the disability adjusted life years lost, while nutritional disorders and maternal child health and communicable diseases are causing 26% loss of life, either prematurely or due to disability, and injuries 10%. So thyroid cancer comes in the non-communicable diseases, while iodine deficiency comes in the nutritional disorders. So let's zoom down to see how much are these two contributing to the disability adjusted life years. So when we zoom down, thyroid cancer comes here. As you can see, it's in the neoplasm. And iodine deficiency comes in the nutritional deficiencies. Let's zoom down further to see where they come further. So as you can see, can everyone mute themselves, please? Thyroid cancer is this small rectangle here. So out of all the different reasons for disability adjusted life years lost, thyroid cancer is contributing to some of the cancers, and iodine deficiency, this dark orange, is the disability adjusted life years lost due to iodine deficiency. So definitely it's not negligible. It is an important cause of disability adjusted life years lost. Thyroid cancer, I'll just focus a little on that. As I mentioned, I'll be talking about Delhi's. As you can see in this map, Philippines is somewhere in the average group. Vietnam is in orange. And then here Honduras is dark red, so it has lots of issues with thyroid cancer. And then Iceland here, uh, but there are variabilities, like South Africa may have less, but they may be diagnosing less. So there are some dark blue, but that does not mean they may not have, or maybe they don't have, but it may be more likely because they have misdiagnosis. Then going to the iodine deficiency, the problems are mostly in Somalia, Ethiopia, and this is Congo, Democratic Republic of Congo. Philippines again is somewhere in the average to a little better. But this is about disability adjusted life years lost. As the previous speaker spoke, many of this iodine deficiency may be hidden because, for example, IQs, as she mentioned, 5 to 10 percentage points drop in IQ because of iodine deficiency. That may not cause any disability, that may not cause any premature mortality, but yet it affects the socioeconomic uh, level of that person and the family, and also the whole nation as a whole. So 35% of the world's population have insufficient iodine intake. So iodine deficiency and iodine induced dysfunction both are important. So if we look at this map, which I'll show in a few seconds, it's measuring the degree of public health significance of iodine nutrition based on median urinary iodine. The figures are until 2006, and then studies were done over 13 years. So we don't have a latest map on this, but as you can see here, there are lots of variations across the world on which country has how much problem. Like if you see Philippines here, risk of iodine induced hyperthyroidism. So here actually the iodine level is 200 to 299, which is above optimal level. So the Philippine population may have more iodine than they need. But again, there are variations across even within countries. So there must be many pockets of people where they have iodine deficiency while others may have too much iodine. So that's why understanding iodine deficiency as well as iodine induced dysfunction both are important. So we have a good balance. So risk factors for all three, I'll mention in a short while. So first, thyroid cancer risk factors. Non-modifiable risk factors are women have about 3 times more risk than men. Of course, we cannot modify the sex of a person. Maybe gender is fine, but sex not possible. Women in 40s and 50s age group, men in 60s, 70s age group. So this is something that we have to take into account. Again, age is age, and then we have to be lookout on this. Hereditary, especially for medullary thyroid cancer, that's important. But again, that can't be changed. But uh, we have to be on lookout for this, like thyroid cancer, more in women and 40s, 50s, and hereditary. And then modifiable risk factors, radiation, that's an important factor. We have to take precautions to reduce risk of exposure, especially in children. Being overweight and obese, that's another big risk factor. Higher the weight, higher the risk. This is something is a pandemic. Being overweight and obese is a pandemic that's probably killing more than COVID-19. And the low iodine intake, follicular cancer, while high iodine intake can cause papillary cancer. So we have to have optimal intake. So risk factors for iodine deficiency, non-modifiable risk factors higher in women than men, especially in pregnant and lactating mothers. So we have to be on lookout for this iodine deficiency in these groups. More common in children than adults. Again, they are also more sensitive to suboptimal iodine, especially because it affects their IQ. Modifiable risk factors are low iodine intake, non-iodized salt, or poor storage of iodized salt. This is important. Poor people, even if they buy iodized salt, even if the variety that they buy, the version that they buy is not stable, then if they keep it in the open, they don't have containers, then the iodine may be lost. Diet high in hormone inhibiting foods like cabbage, broccoli, cauliflower. Of course, don't start reducing your vegetable intake for these vegetables. They are very important. But this can trigger iodine deficiency more in susceptible people. Uh, but if you're taking fish that was mentioned by the previous speaker, then it balances off. Okay, consequences of iodine deficiency. Fetuses and neonates, there could be spontaneous abortion, premature delivery, congenital anomalies. Children and adolescents may have cretinism, impaired mental function, delayed physical development, but also delayed this impaired mental function, as I have mentioned just now, they can be missed because not all of them may be overt. It's just that 5, 10, or 20 IQ points lost, and they may not get good jobs and those problems. Adults, hypothyroidism, impaired mental function, goiter. Goiter is the visible clinical sign and symptom, but many times the impaired mental function may be missed. All ages, hypothyroidism, goiter, increased susceptibility to nuclear radiation. That last one is only if there are nuclear accidents or if, for example, Korea decides to bomb someone, then that's an issue. North Korea. Okay, risk factors, iodine-induced dysfunction. This is the other side of the story. If you have too much iodine, especially like coming from salt, of course we should not stop taking iodized salt. That's a public health measure. It's important, but we have to just see how we can avoid the consequences in some people. Not everybody is sensitive to that salt because that salt, iodized salt, it does not trigger dysfunction in everyone. So individuals with underlying thyroid disease, like Hashimoto's thyroiditis, this is one of the commonest, in fact, the commonest reason for hypothyroidism, especially in middle income countries or middle income families. Uh, uh, and it could be triggered if the person is already susceptible for this. And Graves, so this is hypothyroidism. Hashimoto's thyroiditis is a cause of hypothyroidism, but on the other side, Graves' disease, that's a cause for hyperthyroidism that can be triggered too because of iodine. Fetus in utero, secondary to transplacental passage of iodide. So that may happen. Again, not every fetus may have that issue, but if their mother and genetically, if they are susceptible, then yes. Individuals given other potential goitrogens like lithium. As you know, lithium is given for bipolar disorders. So there we have to be careful. But again, as I mentioned previously, iodine-induced dysfunction is manageable, and how to manage deficiency as well as dysfunction. This is what I'll show. First, the iodine deficiency. Countries should provide high coverage with iodized salt. If low, if the coverage is low, then iodine supplementation for pregnant and lactating mothers should be given in those pockets of populations, or while we are trying to scale up the iodized salt coverage. And iodine-induced dysfunction, this is something that concerns most of us who are on this call. But again, as I said, it's not a serious issue as long as you get thyroid function test at 35 years and then every 5 years. But in some countries, they advise that this may be a concern only to pregnant mothers and lactating mothers. So not all countries advise thyroid function test as a routine test after 35 years. But you may have seen that this is a common test. One of the common tests, even if you go for something else, they may just do this TSH, T3, T4, and we have to manage this function as per results of the thyroid function test. So don't start avoiding iodized salt because of this worry. As I say, it's manageable. So let's see how it's manageable. As I mentioned, thyroid function tests are uh, also called thyroid profiles. As you can see, there are tick mark for thyroid profile, TSH, FT4, TT3. Sometimes we do FT3, which is the free form, and T is the total form. So, and there are many charts. I don't have to go through this, but charts tell us if one is high and the other is low, or both are high, or all three are high, different combinations. It tells you, it helps you to monitor. So it's easily monitorable, and then it can be easily managed also. So to summarize, uh, this is my summary slide. So macronutrition, as I mentioned, obesity, which is due to lots of calorie intake, and micronutrition, which could be either less iodine or more iodine. So that's micronutrition. We have to take care of both in our public health programs and clinical level. And some of the symptom signs may be more visible, while many times it may be less visible. Sorry, I should have written less visible, not less invisible. So, uh, so for example, as we have been mentioning, low IQ is the less visible clinical consequence and may be missed. Micronutrient programs are struggling all over the world because, as I mentioned, we have a pandemic of obesity, and sitting in one place, not moving around, not doing enough exercise, we see is causing more cancers and deaths than COVID. Of course, it's a huge pandemic, and as tobacco is going down all over the world, obesity and lack of exercise is proportionately a huge killer now. And micronutrient programs like salt iodization have made great strides, but there are many pockets of iodine deficiency. And of course, wherever salt iodization happens, or people eat seaweeds, for example, if they have a predisposing factor, then there could be uh, hypothyroidism or hyperthyroidism caused because of that, but easily manageable. Thanks. That's all from my side.
Thank you very much, Dr. Yadav, for shedding light on thyroid as an important non-communicable disease impacting on global health. Now that we have discussed the global impact, let us now hear from the national standpoint. We are honored to hear the key message and updates on thyroid program here in the Philippines. Let us all welcome the Secretary of Health, Dr. Francisco T. Dupi III. Okay.
To all distinguished presidents of various specialty societies, a pleasant and healthful afternoon to us all. It is with great pleasure that we celebrate International Thyroid Awareness Week and World Thyroid Day 2021. Through the theme of this webinar series, Mother Baby Iodine, the importance of iodine, on the woman and her baby. We will raise awareness on iodine deficiency disorders in women of reproductive age, especially pregnant and lactating mothers, and in babies during their first 1,000 days of life. Non-communicable diseases are not only limited to cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases, but also include neglected diseases like thyroid disorders relative to iodine deficiency. According to the 2018 National Nutrition Survey, iodine deficiency still exists among lactating mothers, pregnant women, and even the elderly. The extent and consequences of iodine deficiency disorders in women of reproductive age, especially pregnant and lactating mothers, are known to affect babies during their first 1,000 days of life. Hence, iodine deficiency-related thyroid disorders pose a significant public health concern due to their prevalence and negative health outcomes. To address this, the Department of Health launched the National Salt Iodization Program as a preventive and control strategy. Likewise, we already endorsed the executive order on institutionalizing thyroid disorder prevention and control services in the Philippines for signing by the President. Fully aligned with the provision of the Universal Health Care Act, thyroid disorder-focused interventions such as risk assessment and the screening of at-risk populations, as well as promotion of thyroid literacy, will be included in the population-based services available to every single Filipino, free from unnecessary hardship. Similarly, capacity building for our primary healthcare workers on appropriate care on thyroid disorders shall be done to strengthen service delivery. We will institutionalize thyroid disorder prevention and control services in academic institutions, workplaces, and communities to realize multidisciplinary patient care and make the healthcare system responsive to thyroid disorder patients. Your DOH will continuously collaborate with our multi-sectoral and interdisciplinary partners, expert panels, patient groups, civil societies, and other government agencies to strengthen our efforts against highly preventable thyroid disorders. Through implementation of universal health care, we will achieve our dream of becoming the healthiest people in Southeast Asia by 2020 and in Asia by 2040. Maraming salamat at mabuhay po tayong lahat.
Okay. Maraming salamat po, Secretary Duque. Although nagkaroon po tayo ng konting technical problem, medyo nalilate po yung ating visuals to sa sounds. We're sorry for that. It is true that we all do, that all that we do is in pursuit of the Ambition 2040 for all the Filipinos to have to live a long and healthy, productive lives. Okay. Now to present us the topic on the challenge and family when a child with disability is born, may I now call on Ms. Frances Priscilla Cuevas, the Chief Health Program Officer and the lead for the Specialty Care Division of the Department of Health Disease Prevention and Control Bureau, to discuss this matter. Ma'am Cuevas.
Yeah, thank you all. Could I have a share screen, please?
Yes, ma'am.
So, can you see my slide already?
Yes, ma'am.
Okay. So I'm going to be magandang umaga sa ating lahat. Good morning, everyone. I would like to thank the organizers of this series of webinars celebrating the International Thyroid Awareness Week and the World Thyroid Day. And this aims, of course, to raise awareness on the importance of iodine in the diet of pregnant and lactating pregnant and women and those of reproductive age. My short presentation today will focus on how the government, in particular, the Department of Health, is responding to help families when a child is born with disability, regardless of cause and or category. So let me start off by leveling off with you on how we define disability and the Republic Act 7277, which is the Magna Carta for disabled persons, defines disability as a physical or mental impairment that substantially limits one or more psychological, physiological, or anatomical functions of an individual or activities of such an individual, a record of such impairment, and being regarded as having such impairment. I think this is very important for us to level off, because the World Health Organization also has another definition which looks at this disability as a both a biological and a social construct, and it is actually a result of interactions between health conditions and the environmental and personal factors. And it can occur at different levels, impairment in body functions or structure, limitation in activity, such as inability to read or move around, and this is very important, restriction in participation from in a society, such as work and school and other things that we do as a people. We have also these statistics that we that was taken, unfortunately, this was 10 years or even more than 10 years ago. This is the statistics that they got about the disability situation in the Philippines. There's 1.4 million Filipinos that has a certain disability, and the parameter that they use in defining what a disability is impairment. Kung anong mayroong kulang sa isang tao, then that's the disability. So 1.4 million, and it's actually 1.57% of our population has disability. And of course, there are more males that have disability. More or less equal naman yung males and females, but a little bit more for males. In the regional data that we have, region 4A has listed, kasi we're using the registry, so we have 193 persons with disabilities listed in region 4A. Probably their recording system is better as compared to CAR. We really do not know. So but there are in CAR, ito yung pinaka-lowest among the different regions, 26,000 persons with disabilities. We are going to take a look at the differentiation according to age. We will be able to say that if you are going to have 5, for example, persons with disabilities, one of them would be at the age level of 0 to 14. Another one would be 65 years old and above. And the 3 others will be at the age group of 16 to 64. So we can see that the burden actually is more on the adult population. However, we cannot underestimate also the burden that is being posed by children with disability, because they really would need caregivers, in particular also the elderly. if we are going to take a look at the experiences of and the challenges, that are being experienced by families when there is a child with disability in their family, born into their family, we were able to get from literature some categorizations. So number one challenge probably would be on the family finances and employment opportunities, or even employment challenges. So if you have a child who has a disability in the family, it would certainly incur a lot of costs, because it would probably be on the kind of transport that you would be using, what kind of loads, and if there are special types of feeding that needs to be given. And this is so because that child probably has specific care needs from the rest of the other children in the family. There's also identified problems at work by parents, particularly the time that they probably would be absent from work because of they need more time to care, or probably to care for their children with disability, or to bring them to doctors or wherever they need to be brought. So walang po understanding kung minsan mga employers, and they have also difficulties accessing appropriate childcare or the time that is needed, to bring these children needing extra care to hospitals and other appointments. Another major challenge that families usually would encounter would be the physical and mental health of the parents taking care of their children. So parents who are taking care of these children would usually complain of bad back. Siyempre, they would probably have to carry the child, tiredness. They also at the same time probably neglect their own health needs. Kahit may nararamdaman na sila, inuuna pa nila yung mga anak nila. So sa mga pangangailangan nito. And most often also, they have reported mental health issues or mental health problems, anxiety, stress, and some of them probably would have been stigmatized because of, or discriminated. Some of them would report they are at the brink of losing control. So very important to take note. And it also has some implications on family relationships. Marital breakdowns would probably happen, or family breakups. Children, parents would usually have problems understanding each other, particularly if the focus is on the child with disability and the rest of the family is being neglected. However, there's also a very positive impact of this to some, because the child with disability becomes a rallying point for everybody to get together, and they even become closer because of the disability. Another challenge that is being experienced with families would be loss of social opportunity. Usually, of course, wala silang oras, wala na silang opportunity to socialize. They are isolated probably from the rest of the community, so they lose this. And because they also probably would feel that they are being discriminated for having a child with a disability. So they usually would not join social activities. And the other one would be time pressure. If you have a child with a disability, there's really an extra demand, additional time pressures that are being faced by these families, their parents, as they need extra care, extra time, and extra effort. However, probably very succinctly, I just would like to show you this. One of the parents quoted this, and he said, having a child with a disability, this is what he said, or she said, I wouldn't change you for the world, but I would change the world for you. And I think this is a very telling sentiment from our parents. And this is something that as government agencies should be able to help us. Help us and tell us what can be done. So that is a very heartfelt plea, no? From a parent challenged with a child who has disability. And thus, what is government doing? How is government responding to all of these? We understand, of course, that disability is a social issue and cannot be solved by medical interventions alone. But this really would need a whole of society, whole of government approach. But I am going to tell you what DOH is doing, or how is the Department of Health responding to these challenges. First and foremost, is we would like to prevent disabilities. So all national health programs that we have, isa sa kanilang mga objectives is not only to prevent deaths or to prevent the occurrence of the diseases, prevention of the diseases, but one of the objectives really is the prevention of disability. So for example, we have programs for the prevention and control of NCDs, and what we would like to be able to do is ensure that interventions are being provided, being done, so that persons who are suffering from non-communicable diseases would no longer go into the the further end of the spectrum and get disabled because uncontrolled ang kanyang diabetes or uncontrolled yung kanyang blood pressure, kaya nagkaroon siya ng stroke o kaya naputulan siya ng paa. So we really would like to be able to prevent disabilities in that way. In the same way that the prevention and control of infectious diseases is also being framed act, and it's not only controlling the diseases or preventing the diseases, but it's also at the same time preventing the consequence of the disease itself, which usually would result to disabilities. And one of the most telling programs of the Department of Health would be in the family health programs. No? And in particular, just would like to say that the first 1,000 days law, which has just been recently passed, is very important for us because it says there that the first 1,000 days of our lives shape us. So the kind of people and the kind of persons that we become physically, mentally, is actually being influenced by how well we have been taken care of during our first 1,000 days. If we are going to take a look at the first 1,000 days, ito po yung mga sinasabi natin the services that are being made available for those who are still on their pregnancy period, and then when the child is born as an infant, particularly breastfeeding, supplementation of micronutrient powders and salt iodization, immunization, of course. And when they become young children, then they're also being provided with these programs. So it is very important that, and it is with grateful realization that the law is really ensuring that the Department of Health is, or the government is implementing all of these services to take care of our children, not only physically, but also as they develop their brains particularly. Another if we are also going to take a look at this slide, no? As I said earlier, disability is not just a medical phenomenon, but it is really a social construct. Then the government, as in general, has passed a law, no, to ensure that persons with disabilities are taken care of and their needs met. And we have these mandates, both from the local and international bodies, which provides us with guidelines and standards on how best we can meet the needs of those who already have disabilities, and so that they would be able to overcome the barriers in their participation in society's life. So, and they can be enabled not to fully participate in the workings of society. So we have the Magna Carta for disabled persons, and then we're using the WHO guidelines. We have the rights for persons with disabilities. We have a global disability action plan. And then we also have a revised policy on the health and wellness program for persons with disabilities. And now we have also revised the implementing rules and regulations on how we these people, persons with disabilities, can access or benefits from the mandate of 70 to 77. And that is discounts, no, that is being provided to them. So with those mandates, one of the most important benefit that is being provided by government to persons with disabilities, and it may not necessarily be enough, but helps in the financial needs of the family, is the giving out of this persons with disabilities ID, no? And the Department of Health is responsible for registering persons with disabilities across the country, and from there, they are being provided with this ID so that they can use this and they can avail of the discounts that they can avail of discounts of the goods and they are buying probably, or when they are in restaurants, they can use this, and transportation costs and so on and so forth. The Department of Health also has a program specifically on the health and wellness of persons with disabilities and their families. This is a program that is that the main objective is for persons who are already with disability. They are going to have access, not to improve access to health services. Ang problema kasi sa mga persons with disabilities and their families is that because of the difficulty of moving around probably, and the cost of travels, etc., they usually wouldn't have access to various health services. So the program itself is geared towards ensuring that we improve access to health services of these persons with disabilities. And of course, we ensure that if they need rehabilitation services, then it can also be provided to them at any level where these are going to be available. Another benefit, and is very important, I think, for the children that we are talking about, is the Z benefit package that PhilHealth has developed, you know, for those children with disabilities. So we have a benefit package for those with hearing impairments, and include professional assessment, diagnostic tests, hearing devices, rehabilitation, speech therapy, that would enable the children to gain functionality in hearing communication. Also, there's a benefit package for those with visual impairments or low vision. Includes, of course, assessment again in provision of these optical devices as needed. The rehabilitation also is very important and included po sa package po yan. We also have a package for mobility impairment for those na are going to be using wheelchairs to support mobility and to make them able to move around. There is also a mobility device and rehabilitation component that is being provided, being made accessible through the Z benefit package. And the last benefit package actually is for those with developmental disability, which is a very important, I think, topic for us also in this because of iodine deficiency. And this includes services for proper diagnosis and specific individualized plans for therapy for children with developmental disabilities, so that they can optimize their capacity and increase their participation in the community. So in essence, those are the different services that are being made available, or the response of the government, particularly the Department of Health. But I would like to say that in the pipeline, we have a mental health law that is that has included, in its implementation of the law, developmental disabilities. It includes not only psychiatric disorders, but also neurologic disorders, and in particular, developmental disabilities. As of the moment in the pipeline, as we are implementing and strengthening the mental health, the implementation of the mental health law, we are working on a community-based mental health program. And we realize that the community has resources that are available, and they should be made available to those who would need them. So a respite care program can be instituted for families, for parents probably who would need to take some time off in taking care of their children. We also have a program for caring for the carers, although this is something that is built into the mental health program, but this is something that can be availed of by other carers for disability, because mental illness and neurologic disorders are actually already considered as disabilities. So capacity building for home care, we will be capacitating parents on how to properly care for their children at home. Those with disabilities can be taken care of at home. So these are in the pipeline, and we will be rolling this out hopefully by next year as we finish the framework that we are doing for this mental health program, which is still being piloted in one of the areas in the country. So I would like to just say that before I say thank you, we know that responding to the challenges being experienced by families who have children with disability cannot be met by the Department of Health alone. So medical interventions, public health interventions would not be really enough in meeting the challenges experienced by these families, but we need a whole of society, whole of government approach in ensuring that all of the needs of, well, most, if not all of the needs of these families would be provided for, all will be met. And the continued advocacy of those advocates, persons with disability advocates, and the National Council for Disability Affairs, and of course, the Department of Health and the entire government sector, which has a stake on persons with disabilities. We hope that we will be able to do more programs that will ease the burdens placed on the shoulders of our families. And so again, I say thank you so much for the opportunity today.
Thank you very much, Miss Pressy. Thank you. Please stay, Miss Pressy. Q&A portion na tayo. Pang Miss Universe yung mga questions natin. So we have here Mr. Dr. Yadav and Ma'am Pressy Cuevas. They will be entertaining your questions. I think I have some listed here. Hi, Dr. Yadav. So I think the first question is for you, Dr. Yadav, although you have answered this. This came from T. San Luis Jr. Are thyroid disorders now included as non-communicable disorders? If not, or not yet, what will it entail to be considered as such? Dr. Yadav?
So yes, can you hear me?
Yeah, we can hear you.
Yes.
Yes, you can.
So as I mentioned in the chat, WHO already recognizes thyroid issues as major issues, especially thyroid cancers and iodine deficiency. As I mentioned in the chat, thyroid cancers are one of the important cancers that we have to address as a non-communicable disease, and iodine deficiency, we are working with UNICEF on that as an important micronutrient. Thank you.
Thank you, Doctor. Another question is, this came from Dr. Clarito Cairo Jr. Thyroid disorders are considered as one of the neglected non-communicable diseases. How will WHO address the burden of these neglected diseases to what is being done towards the 4 major NCDs, namely CVDs, cancer, diabetes, and chronic respiratory diseases? Thank you, Dr. Yadav.
Yes, actually the whole non-communicable disease has been neglected for decades. We were focusing more on communicable disease during the Millennium Development Goals. But in the Sustainable Development Goals that we are now aiming for in 2015 to 2030, non-communicable disease is up front in our agenda, and cancers, including thyroid cancers, and nutritional issues, including iodine deficiency, are really at the top of our agenda. So, but as we don't deal with each of these separately, as Department of Health is also doing now, we have to use integrated approaches to mobilize resources and commodities and human resources to address these cancers as part of the whole spectrum. Of course, at the clinical level, we have to be very specific for each different cancer, but from public health point of view, we have to use integrated approaches. Thank you.
Okay, thank you, Doctor. So I have, I think, 3 questions for Ms. Cuevas. The first one is, how does the government intervene for those who apply for disability and given the ID, despite the fact that we are not actually qualified? Oh, how do we strengthen categorization of disability, and how do we monitor fraudulent application of disability? Oh my God, Ma'am Pressy?
Yes. Yes, this is a very timely question, and this is something that has been a subject of inquiry even from Congress because of the proliferation of fake IDs or fake claimants of the IDs. Well, in the Department of Health, we are actually strengthening our and reviewing the kind of, because we have a registry that we are using. So we have revised the guidelines and categorizations of who are the persons with disabilities. And so this is an ongoing thing that we are now doing, particularly together with NCDA. The monitoring actually of fraudulent cases would fall upon the purview of the National Council for Disability Affairs. And so if there are some fraudulent cases, then you can tick them off. to the National Council for Disability Affairs, and even the local government units, because they are the ones actually issuing the IDs. So this is something that is being tightened up and being worked up by the National Council for Disability Affairs.
That question came from Dr. Nin Pafutong of SLH. Siguro, Ma'am Presi, this is a rejoinder or parang continuation. Sino ba talaga yung responsible for the approval of the application of disability IDs? So,
it's the local government units. The local government units are the ones which is issuing the ID. However, there are guidelines that are being issued. There are certain parameters that you should be using, and because there is always new people sometimes in the area, so maybe not all of them are able to really provide the correct guidelines, kaya nagiging fraudulent yung IDs. But this is really the responsibility of local government.
Okay. May say ba daw ang DOH dito, or do you have any regulatory function on this?
Yeah, that's the reason why the National Council for Disability Affairs is the one which monitors. The Department of Health is the one which provides the guidelines, technical guidelines, on how a person with disability is supposed to be categorized, recorded. How do you do that? And as of the moment, because there are already some new categorizations, the program is working on a new guideline actually to ensure that medyo mas pasinsin, yung criteria that's being used for this purpose.
This is the reason why I think Dr. Putong says, please do involve or engage PWD people when crafting guidelines or policies.
Yeah.
Kindly involve them. Okay, so that's a note from them. Another question is that most of the services for children with disabilities are done as outpatient basis. How do we avail of the Z packages for children with disabilities?
Yeah. These are actually Z benefit packages that are being provided in different PhilHealth accredited facilities. So pwede siya ma-avail doon sa mga PhilHealth accredited facilities. There's a listing from PhilHealth kung which of the hospitals have been accredited to provide. Kasi dapat may provider ito eh. The facilities has passed the standards so that they are able to provide. Marunong sila magtingin, meron silang nagtitingin, merong nag-assess, and so on and so forth, based on the criteria that they're using. So tingnan na lang po nila sa PhilHealth which facilities are being able to provide all of these benefit packages.
Okay. O kaya pagpunta niyo po sa hospital, tanongin niyo na kagad kung nasan yung PhilHealth office ng opisina ng hospital para pwede kayong magtanong sa kanila. Okay. Ma'am Presi again, question for PWD who wants to avail. Paano po ba yung po kaming mga may thyroid cancers, lagi pong dinideny when we are trying to apply po sa mga respective MHD offices sa lugar po namin. Madalas po ay iniinsulto pa kami ng mga, oh my God, nakakalungkot to, ng mga empleyado kasi po kailangan daw ma-revise something, siguro yung non-cancer patients guidelines natin. This is from Ma'am Clarissa.
Yeah. This is an issue that has been ongoing. The cancer law provided for all those with cancers to be already categorized as persons with disabilities. Well, not all, of course, advocates for persons with disabilities would agree on that, but that's the reason why there is already there are changes that will be made on the categorization. Hindi pa lumalabas yung bagong guideline for this. So they are going to be pag may cancer na, there's a siguro rejoinder ito pag non-cancer thyroid patients. For non-cancer, for cancers kasi ano na yan persons with disabilities ang treatment sa kanila. For those with kasi ang disability actually dapat may kakulangan ka, and in the interaction with the environment you are unable to participate in the society, no? So mayroong barriers, no? That's why may disability ka, you are not able to participate, no? Because of the problems or the medical conditions that you have. For thyroid, kailangan po makita siguro kung ano ba yung kaniyang mga disability, no? Ano bang problema niya? Ano bang functional limitations ng pasyente? It's not the it's not the diagnosis. No? You don't use the diagnosis to say that you are a person with disability, except at this point in time for cancers and those with rare diseases. Yes.
Okay.
So what is the disability that occurred because of the thyroid problems?
Okay, thank you, Ma'am Prasi. I think the next question is still for you. What is the median UIC, urinary iodine concentration for the Filipinos? And what is the household coverage of adequately iodized salt consumption in the Philippines? That's from Rosie Jafar.
Oh, I don't have the exact information on that, but there is, I think, in the course of this series, there is Dr. Dayang Hirang. She's going to talk about salt iodization and all of these things, and maybe your question can wait for her to be able to answer you. I'm sorry about that at this point.
I think yung lecture ni Ma'am Dayang Hirang will be tomorrow. So, ibig sabihin, Sir, Ma'am Rosie, makikinig or makakasama ka pa namin bukas. Okay? Ito yung maganda. Can persons with 250 to 350 I grade avail of PWD benefits? 250 to 350.
Well,
500 ako, Ma'am Presi.
This would really need probably specification of this regard by an ophthalmologist para po masabi nila talaga. So we will you have to give the local government unit the proof that you have this type of diagnosis.
Okay. Next is, I think, we would like to ask DOH kung may monitoring system daw in checking the implementation of various family health programs like the first 1,000 days law. We have the stats as to its impact since it was started. How do we measure the effectiveness of our programs?
Yeah, well, there are, I think, again, the Director Dayang Hirang is going to be presenting something tomorrow. No? But just to be able to say na how do we gauge, anong monitoring natin every so often, I think every 3 years or every 5 years, there are researches or surveys that FNRI is doing, and it is actually, monitoring the different levels of results, no? Kung ano mang meron tayong pangakailangan in terms of our diet and ano karaming salt na kinakain natin, ano karaming iodine meron tayo. So meron yan from the FNRI, Food Nutrition Research Institute, and this being done. May monitoring yan sila through the surveys that they are doing, I think every 3 years or so.
Okay, so tomorrow din po may FNRI lecture, I think, sa series natin bukas. Last question, meron bang free na biopsy for thyroid patients?
I'm sorry, I cannot answer that. Maybe Dr. Clar would be able to answer that kung may free biopsy po tayo. But just in case there's a need, I think yung ating mga malasakit centers would be able to help you with this in this regard. And Dr. Clar is nodding
Dr.
his head.
Clar, may free
Yes,
biopsy daw po ba?
If I'm not mistaken, kasama siya sa case rate ng ating PhilHealth as part of the diagnostic workup.
Okay. So, I think Ma'am Presi and Dr. Rajab, we are now closing that Q&A session. So at this juncture, we have reached the end of today's session. We would like to call Dr. Clarito Cairo Jr., the Medical Officer of the Cancer Control Division, to present the certificates of appreciation to our speakers. Dr. Cairo, please.
Thank you, Ate Al. Good afternoon, everyone. So allow me to present these certificates. The Department of Health awards this certificate of appreciation to Ms. Linda Henderson in grateful appreciation of her invaluable contribution as our distinguished resource speaker on the Mother Baby Iodine Project, a global awareness campaign on May 24, 2021, during the week-long virtual observance of International Thyroid Awareness Week and World Thyroid Day from May 24 to 29, 2021. Signed by Dr. Maria Rosario Vergere, Undersecretary of Health, Public Health Services Team, Department of Health. Thank you very much, Ma'am Linda Henderson. The same certificate will be awarded to Dr. Rajendra Yadav for his talk on the thyroid as an important non-communicable disease impacting on global health, signed by Dr. Maria Rosario Vergere. Thank you very much, Dr. Yadav. And lastly, our distinguished resource speaker, Ma'am Frances Priscilla Cuevas, for her talk on the challenge and the family when a child with disability is born, signed by Dr. Maria Rosario Vergere. Thank you very much, Ma'am Presi. Over to you, Ma'am Au.
Thank you very much, Dr. Cairo. May I request everyone to please open your cameras for a photo opportunity. So, bubuksan po natin yung ating mga cameras para mag-picture-picture for documentation. Ms. Dali, kindly give us a cue kung kami ay ngingiti na. Hi, Dr. San Luis.
Lucky, kindly unshare the screen so that we can have the gallery view. Thank you.
Lahat po tayo magandang smile.
We have 7 slides in total. Keep your cameras open po. Smile, 1, 2, 3. Next slide. 1, 2, 3. 4 more. 1, 2, 3. And then the 5th one, the 6th, and the 7th. All covered, Ate Au, over. Thank you.
Okay, thank you, Ma'am Dali. Okay. And to give us a glimpse of our second session tomorrow, as seen on the screen, papakita na po natin yung sessions tomorrow. We have another international speaker from the Iodine Global Network and the director from FNRI and the National Nutrition Council to discuss important topics related to iodine deficiency, National Nutrition Survey, and the National Salt Iodization Program. So makikita-kita po ulit tayo bukas. Okay. We hope that you will join us again tomorrow as we continue to celebrate the International Thyroid Awareness Week. Kindly register on the same link or scan the QR code on the screen, ma'am. May we invite everyone also, so natapos na po tayo, to take the survey on the screen. So may survey po kami ibibigay. Please let us know how we can improve our learning sessions by completing the feedback survey through the link or scan the QR code. Your certificate will be sent upon the completion of the survey. Thank you once again. Stay safe. Always wear your mask. Follow the minimum health standards. So lahat po tayo mag-ingat. Maraming salamat po. So nakikita niyo po sa screen niyo yung link para sa feedback survey. Ingat po tayong lahat.